All right, so lines are primed. Now I'm going to gather my supplies to head into the room to start the IV, okay? I have an IV start kit, a gel co. I've brought an additional ChloraPrep, and I'll explain that later. I have an extension thing that has an INT end on it, okay? Blushes, dead end cap, alcohol swabs, gloves, and goggles. Okay, y'all must wear goggles. So I'm heading in the room with all of my stuff, and I've got this big old pump. You going down the hall, blam, 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 blam. Okay, and that's really what it sounds like. All right, and then you knock, 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 and you come in, and pretty much it sounds like blam, blam, blam on the way into the room too. Okay, and you say, "Hi, I'm Laura. I'm going to be your nurse today. Can you please tell me your name and date of birth?" John Doe 7658. Okay? At that point, one of two things can happen. I've set down my stuff. I'm going to the sink and wash my hands. And I'm going to have a conversation while I wash my hands. Okay? I'll say, "Mr. Doe, today I need to start an IV on you. Have you ever had an IV before?" "No." "Okay, an IV is going to be a catheter in your vein so that we have intravenous access in case we need to give you fluids or medicines. Your doctor, in fact, has ordered you both fluids and medicines, okay? It does involve a stick. We will remove the needle and leave the catheter in. Any questions?" No, that was a wonderful explanation. Oh, thank you. All right, are you allergic to any betadine, iodine, shellfish, or latex? No, I don't believe I have any allergies. Excellent. Okay, well, to start off with, I'm going to be putting a tourniquet on your arm, and then I'm going to sit up. Before I stick you, I will tell you. Okay, that will be fine. In your IV start kit, there is a tourniquet, okay? How many of you this past semester always had a free bedside table to move around the room any way you wanted to? Every time? No, we rarely did. In fact, some of the rooms didn't have a bedside table and you had to go find them, okay? All right, so I am suggesting to you that you need to locate a vein so that you set up on the right side of the bed to start with. Usually we may set up on our field on the bed, a towel under the arm or whatever, and if we end up getting all set up and we don't have a vein, we have to move everything, okay? So we want you to take the tourniquet out, and I want you to start up high and put the tourniquet on. All right, Dana, can I borrow your arm?
Yes, ma'am.
Okay, the reason why I want you to start up high. Now, y'all were taught that we start distally, if possible, or if there's no contraindications to starting distally, okay? Well, okay, here's how this would go. I'm gonna put a tourniquet on, it's gonna be tight. Purpose of a tourniquet is to do what?
The veins, pop veins up.
Occlude venous flow, trap that blood, not arterial flow, so I have to take a pulse, right? No, she doesn't have anything. This is gonna be tight.
Okay.
This is gonna be tight. What's happening here, guys?
Cutting off circulation to my hand.
Seriously? Do I need to move it 3 times? Whenever what I could do is start it up here, put it on up here. This is going to be tight. Put it on, check a pulse, and I can scan all of this. Okay? So, and she has amazing veins and would be happy to let everybody start an IV on her, okay? So, for the person that doesn't have good veins, rather than move it 3 and 4 times, start it high, locate your vein, okay? Thank you. So, I'm going to start this high. It's going to be tight. Check a pulse. I'm locating my vein. Oh, here's a good one. Pop your tourniquet. Move it down 4 to 6 inches above where you're going to start. Okay? And just leave it. Now I'm going to do my setup. All right? Because I'm prone to forget goggles, I'm going to go ahead and put the goggles on. All right, guys, I do insist that the goggles go on before your gloves. All right? How many of you walked into a restaurant and seen them wearing gloves? And it makes you feel so happy, okay? Until they turn around and they do this. Okay? Well, if you're trying to get goggles all on and you got your gloves on, now, right now, I would say I need to wash my hands again. But once y'all get those gloves on, you think you're set to go. And if you're putting the goggles on around your face, I don't love that technique. Do you love that technique? Then let's don't use that technique, okay? All right, so I've got my goggles on. I can do setup without gloves or with gloves. The most important thing is actually this, because what is in this line? What is inside? Air. So, do I want air in this to end up in the patient? No. So, what do I have to do to this? And how do I do that? Say the word. Prime it. Prime it. Okay? So, I need a flush. This is my extension, and this is my flush. Okay? Now, for the purposes of expense, we did not order Alaris extensions. Okay? Y'all's extensions are not going to have clamps on them. If they do have clamps, extensions with clamps, you do need to use them. Most extension sets these days directly attached aren't. They are positive pressure, okay? So, how is this packaged? Sterilely, unless I touch it with my hot little hand, okay? So, I'm going to peel this open. And I'm going to lift it out. Now I can look at the ends and see what I'm doing. Remember, guys, the more you screw with something, the more likely you are to screw up, okay? I am going to tell you that it is male to female, okay? Aspirate, push your air out. If I take this cap off, it's another male end, okay? I prefer not to take it off, but you see that's a male end, so if you did take it off, just put it back on. Did we contaminate? No. So it's going here. I did not clean it because it was sterile. If I dropped it on the table, could I have cleaned it? Or should I have cleaned it? Yes. If my hand touched it, should I have cleaned it? Yes. Okay. Now I can take off all that paper and everything. Where does air rise? To the top. So now I'm going to push my fluid through. Do y'all see it? Yes. Now, sometimes with some of the connectors here, there's a little airspace. I'm not sure where. I've taken them apart. I've looked at it or whatever, but I'll prime it, and then whenever I go to inject it, I'll have a little space of air come. So to remedy that, I pull back so that anything that didn't prime the first time fills, and I push it, okay, and prime. I want to loosen this cap. I do not want it to come off, because if it comes off, it's contaminated. Now, guys, I don't have a problem if you feel better laying it in here, but is inside here sterile? No, so I need for you to be very clear that if the cap comes off and it's in there, it's still a contaminated tube. All right? I don't like a whole lot of stuff to fuss with, so I get rid of mine, but you can certainly leave yours in there. You just have to understand, if the cap comes off, it's not sterile. Okay? Now, as to what I do with the rest, I just kind of separate it out. We no longer tear tape before we put the opsite on, so I don't have to do that. And I just separate my stuff out some, okay? I'm trying to get it so y'all can see. So I'm gonna tear this off. Does it matter that this fell on the table? No, because it's backed, it is sterile, okay? Alrighty. Now, what y'all will typically see in the hospital will actually have one of these ChloraPreps in it. I'm going to demonstrate both just so that you can see, but what the hospital kit looks like is this, okay? So I've got my line primed, got my stuff set up. Here's my gel coat